Through the Neurosurgery and Neurology Institute of Solidarity Bridge, we work to alleviate this unnecessary death and disability. With a focus on education, resource mobilization, research, and service, we are transforming patient care in Bolivia and Paraguay.
We're back here at the Hospital Santa Barbara with surgeons, residents, neurologists who we've worked with and are developing a deeper relationship. These relationships have been actually even more deeply embedded over the time of COVID as we've developed Zoom platforms, as we have WhatsApp communications, so that we have not just occasional conversations, but frequent and constant contact.
The Santa Barbara Hospital in Sucre is a fairly unique hospital throughout Bolivia. It's the reference hospital for not only Sucre, but the entire department of Chuquisaca, as well as the departments of Tarija, Potosí, Oruro. So it plays a very large role in the ability of the residents of this area, which probably encompasses at least over 1 million people. It's their reference hospital for neurosurgical care. Neurotrauma is the single biggest problem that they deal with. And neurotrauma represents probably 80% of the work that they do.
Tenemos un montón de pacientes que llegan al servicio de emergencias, los cuales requieren este tipo de atención. Muchos de ellos, lamentablemente, de escasos recursos, que a la vez no pueden cumplir con ciertos requisitos o materiales que se requieren para este tipo de cirugías. De esta manera, Puente Solidaridad nos ayuda, nos colabora para poder cumplir o poderles dar una calidad de vida mejor hacia futuro a este tipo de pacientes.
Por una parte, vienen los médicos de Estados Unidos a contribuir con su conocimiento, con la tecnología que ellos manejan, con la vanguardia en cuanto a técnicas quirúrgicas e instrumentación. Sin embargo, también reciben cuando vienen de nuestros médicos bolivianos la creatividad, la capacidad de respuesta a los problemas que se producen en la realidad de salud de nuestro país con las limitaciones que se tienen.
Equipping doctors and nurses at Hospital Santa Barbara is key for us to improving access to health care of their patients. Donors from across the United States, doctors, nurses, medical companies, surplus recovery organizations all contribute to our equipping efforts. The team at Hospital Sisters Mission Outreach, one of our greatest allies in these equipping efforts, make a safe and efficient delivery possible. Santa Barbara is one example of a hospital where we're doing this equipping work, but it's not the only one. This year alone, we have provided major medical equipment upgrades to 5 large public hospitals in Bolivia. But beyond that, we have distributed medical supplies to over 50 second-level hospitals and clinics throughout Bolivia, reaching very remote areas in the country. For all of us, this is something to celebrate, and at the same time, something we must continue to grow, expand, and hopefully replicate.
Los pacientes se benefician porque Puente de Solidaridad tiene material disponible para realizar algunas cirugías que nuestro hospital carece de ello. Entonces, Puente de Solidaridad además nos hace algunas donaciones que son de mucha utilidad acá en el hospital.
Lo que se siembra se cosecha. Pienso que estamos sembrando enseñanza, estamos sembrando servicio, estamos en una etapa de perfeccionamiento que nos va a llevar muchísimo tiempo. Pero todo esto va a ir mejorando y seguramente con los años y con las idas y venidas de la misión vamos a lograr un nivel superior al que en este momento tenemos.
Just working with our colleagues at Santa Barbara, with Dr. Gardiazabal and others, Dr. Freya, we feel the common bond, the relationship. And so that has developed over these years and will continue to be the foundation for all of our future projects. This is just the first step of a multi-year project. One thing that Bolivia has is a very rich human capital. The doctors here are well trained. They want to serve the citizens of this country. Their desire is strong to provide the best possible care. And they're looking for more educational opportunities, more training, mentoring, and the resources to do the things that they know that should be done and want to do if only they had the resources available.
The work with Solidarity Bridge impacts me personally and deeply. It's a different practice than I have in the United States. Sometimes I can bring resources, ideas, techniques that might be novel to my colleagues here. And oftentimes I learn much from my colleagues here too. So in between those two cultures and experiences, we share the science of medicine and the art of patient care.
Let's invest. Let's invest in these services so that we can help everybody in this whole entire region have better access to safe, timely, and affordable care.